Welcome to segment 6, and tonight we're going to be talking about healthcare with Dr. Nick Stella, who is in the primary for the 11th Congressional District. Our healthcare system in this country is something that you are eminently qualified to address. One of the big problems I think that everybody faces, whether they have insurance or they don't, and particularly if they don't, the cost of healthcare is over the top. It's totally outrageously high. A lot of that is because you got tort issues, right? You got insurance that's astronomical.
There's no doubt about it. The costs of medical malpractice are definitely a cost driver in the overall cost of what you're paying when you go to the doctor, when you have a surgery, when you go to the hospital.
I related to you that my oncologist gave me a medication, and it was $9,000 a month, of which I didn't fortunately have to pay. But I don't know. Is there any way a doctor can be sued for anything? There's some industries that they've managed to kind of shield like manufacturers or whatever, as long as there's not gross negligence on their part. But as a doctor, you can be sued for basically anything.
Basically true. It basically depends upon a person finding a lawyer who's willing to take their case. Different states are different, though. Some states have a panel of physicians that any lawsuit that someone wants to file has to go before the panel of physicians first. If those physicians deem it to be a credible case of malpractice, then the case can actually be filed and it can go to the court system. As you can imagine, all of the frivolous lawsuits in a situation like that are pretty much weeded out by that panel. Other states, like Illinois, they don't have any such panel. So basically it depends upon you being able to find a lawyer who's willing to bring a case to court. So this has resulted in Illinois being one of the most difficult states to practice in. There's hospitals in Illinois that don't even have neurosurgeons on staff. They've left.
And when we talk about hefty insurance premiums, to the average homeowner, they're going, oh, how much is it? $3,000, $4,000? We're talking about multiples, are we not?
Yes.
$10,000, $20,000, $30,000 a year?
That would be quite nice in Illinois.
That'll be on the low side.
Yeah, you're talking six figures in some situations.
And I related to you the friends of mine who were they had a little practice. One was an OB-GYN, one was a GP up in northern Michigan, and with no suit against them, no claim against them at all. After about 4 years, 5 years, their insurance premium actually exceeded the gross of the previous year. Put them out of business.
Yeah, it's unfortunate. We lose very good doctors in that manner. I trained with a woman who met her husband in their residency program up at the Mayo Clinic. She came down and did cardiology in the program that I was in. And her husband, once he finished his training at the Mayo Clinic in neurosurgery, came down to the Chicagoland area to begin practice. I think he was in practice for 2 or 3 years while she was finishing up her training in cardiology. As soon as she finished her training, they left the state of Illinois. They actually moved up to Wisconsin because he was a Mayo Clinic trained neurosurgeon. It's what he loved. It's what he wanted to do for a living. And practicing in Illinois as a neurosurgeon, his malpractice was so high that there were surgeries that he was not able to do. Not because he wasn't qualified to do those surgeries, but from a malpractice standpoint, he wasn't able to do those surgeries. So the solution to that was they left Illinois.
Basically, in that instance, what you have are corporations making healthcare decisions for an individual. De facto.
The American public probably doesn't know that, but doctors in many instances aren't really able to practice medicine anymore. It is corporations, insurance companies, and in some cases, the law firms prohibit us being able to practice. But when you talk about corporations practicing medicine, yeah, that's definitely true. Doctors are limited by the insurance industry as well as by the legal industry.
I find it's a rare doctor that will even take the chance of going against whatever medical association they belong to, whatever their specialty is, to meet your specific needs, because if they don't follow that recommendation from that association to the letter, that opens them up for malpractice. I've had that situation with my doctor where she's like, well, you don't really need this test every year. We can do every 3 years. But, she's taking a risk, if she does that.
Yes. Well, that's one of the problems that we've had. In the healthcare field, there is a small group of academic physicians and a large group of private practice physicians around the country. And sometimes many of the I don't want to say governing bodies, sometimes some of our associations decide it's a good idea to publish guidelines to help physicians kind of stay abreast of what's going on. The problem is that those guidelines are then used by the legal industry to say, well, doctor, this guideline said, and you're a member of this society, and you didn't follow this guideline.
It basically becomes SOP.
Exactly.
And those are people that don't even deal with actual people on a daily basis.
Yes, in some instances. And then the other big problem is the insurance industry. A perfect example is what I do for a living as a cardiologist. One of the very common tests that I may order is a stress test on someone.
Sure.
Unfortunately, the truth of the matter is, in many situations, I'm not allowed to order a stress test. You might say, well,
why not?
Why not? Exactly. Thank you.
You're welcome.
And it didn't require a cue card. That's great. Yeah.
Happy to oblige. Happy to oblige.
I can see a person and I can decide that this is the test that they need. They need to have a stress test. However, every test has to be paid for. So when I decide to order a stress test, the insurance company has to approve that they will pay for the stress test.
Sure.
When I started in practice, basically I would order a stress test, the insurance company would approve it, it would get done, and the patient would come back to see me, and we talk about the results. Nowadays, a week doesn't go by when I personally do not have to get on the telephone to talk to someone in an insurance company to justify why I think the patient needs the stress test.
Sure.
So if I can't convince the person on the other end of the phone that this patient needs a stress test, they deny it. And then in spite of the fact that I believe they need a stress test, their options are don't have a stress test or pay for it out of pocket.
Which is astronomical.
Most people are not willing to pay out of pocket. Testing is a couple $1,000s. And they say, well, if my insurance company won't pay for it, I'll go without.
And there is this other thing that people go, well, if the insurance company doesn't think I need it, do I really need it? They don't get it's about money.
And they don't
Exactly.
get that the person that you talk to who's on the other end of the phone is probably not a doctor.
Well,
they're probably not your equal.
That's the way the insurance companies like to play this. Is usually these are what they term peer-to-peer interviews, that I will speak to a doctor when I call the insurance company. But I've yet to speak to a cardiologist when I call.
Sure.
I've spoken to radiologists, pediatricians, oncologists.
General practitioners.
I'm sure that they know their field very well, but they don't quite know cardiology as well as I do.
Yeah.
Right.
So the big question is, what would you do? If you go off to Congress, I mean, what could be done for that?
Well, there are a lot of changes that need to be made to our healthcare system. What I think we need to do is to approach it in an intelligent manner. There are some facets of the healthcare system that are fine. There are others that are horrendous. And we need to take each facet individually and decide which we can live with for now, which we like, and which we need to change. As opposed to what they did with the Affordable or Unaffordable Care Act. It's basically just change the whole system. The very first facet of healthcare reform needs to be tort reform. The cost drivers in healthcare need to be addressed. And you talk to any physician, they will tell you that there are many, many, many tests that are ordered simply to cover yourself and to prepare to prevent a lawsuit in the future. The current administration said, "Oh no, that doesn't exist."
Oh.
Well, you have to realize that our current president, what did he do before he was president? I think he was a lawyer, wasn't he?
It's kind of was, yeah.
Sort of.
As an expert witness, I will tell you that the first thing we go after is what you should have done. If it was available to you, then we're going to say, well, why didn't you do it? In hindsight, it's always easier to say that.
Of course.
It's a gotcha, no matter how you look
Of course.
at it. You brought up something interesting before we started the show, and our system is a tiered healthcare system. There's different players get different benefits.
True. The public typically doesn't realize this. I look at it as a 3-tiered system. The top tier is those with private payer insurance, Medicare with supplements, and that's basically the best tier. Most testing is done in an efficient manner, an expeditious manner. The quality of the care is typically the best. The second tier of healthcare is what I fear may be the future of healthcare in the United States, which is government-run healthcare. Harry Reid came right out and said the Affordable Care Act was the first step towards single-payer healthcare, which is a moniker for government-run healthcare.
And they couldn't even get the website to work.
How much money was that spent on that again?
For $100 and a case of Doritos, they'd have gotten a 12-year-old kid who'd have done it overnight.
Yeah, I think it cost a little more than that, didn't it?
It sure did.
Yeah.
Government-run healthcare we have in this country. Ask any veteran that you know who's been in the Veterans Administration system. I worked in that system during my training. I know the system well, and everything that's come out nowadays that's hit the media recently, that's not a surprise to those of us who worked in that system. It's not to say that all veterans' healthcare is horrible. There are some very, very, very good doctors in the Veterans Administration. There's some doctors who aren't so good. There are some employees in the Veterans Administration who really care about veterans. Unfortunately, there are those who are there because it's a government job. But that is what government-run healthcare will look like. That's what I fear we're heading towards. The third tier of healthcare in the United States is Medicaid. And this administration has pushed, I think it's over 16 million people into the Medicaid system. Medicaid really is a third-tier system that provides inferior care to people. 50% of specialists, 30% of primary care doctors don't even accept Medicaid. So if you are given Medicaid, you can't go to any doctor you want. Your options are severely limited. There's also data out there that shows if you take two people with the exact same disease process, one with private payer health care and one with Medicaid, the person with Medicaid does worse. They have worse outcomes. They will die sooner than the person with a private payer health insurer. And yet this administration, wanting to help the poor, has given them this third-tier system.
And, when they talked about this initially, Obamacare, they were talking about people who didn't have insurance. And I have always said, we're too wealthy a country for anybody to not get help if they need help. But instead of taking that small number of people who had no options, or people who had an ongoing disease and they couldn't get insurance if they transferred, instead of taking the money and solving that little problem, they just pulled the rug out from under everybody.
Exactly. I mean, like you said, there are a couple of good things that have come about through the Affordable Care Act. The pre-existing disease exemption.
Much needed.
Definitely, and I don't think you'll find a doctor who will disagree with that. That's wonderful, and that's something that should be maintained. However, there are so many consequences of the Affordable Care Act that the framers of it never realized, never had a clue would occur, and now we're seeing all of that. It's unfortunate. Like you said, if we would have just concentrated on those people who needed care. The other problem is there was care for those people who did not have insurance. Anybody who walks into an emergency room with a true medical problem is not denied care.
Yeah.
They are cared for. Believe me, I've been up at 2 a.m. many times with people having heart attacks, providing the exact same care to them, even when they've had no insurance whatsoever, as they do to people who have the Cadillac of insurance plans. I didn't differentiate between one person who had insurance or didn't. I got up out of bed, I went in, I did my very best each and every time. So, not to say the system was great. It definitely wasn't. It definitely needed to be changed. But instead of changing it part by part, as you said, they pulled the rug out from under everyone. They just decided they'd change the system.
And the last thing I just want to touch on real briefly is this is all essentially leading to socialized medicine. And the thing that has bothered me about this is they're using this administration has clearly been using this particularly to get at gun owners. They have some doctors, none of mine have done this, but I've actually talked to people who said they have. During a routine physical, the physician asks them, do you have guns in your house?
Yeah, this was a clever little bit that was put in, not necessarily as part of the Affordable Care Act, but one of the other nice little surprises that was foisted upon physicians was the electronic medical record system.
Right.
Computerization of all records. And this wasn't part of Obamacare. This actually came before Obamacare. But it was utilized by the government to tie doctors' hands in certain respects. Basically, physicians were mandated by the government to computerize their records. And we can sit here and talk for hours about whether that's good or bad, but I won't bore you with that. But in order to make it more palatable for physicians, the administration said, well, we're going to give you a little bit of money if you do this. Well, in order to get the money, you had to meet what was called meaningful use. So the government set up parameters that the doctors had to achieve in order to get money from the government to help offset the cost of computerizing their system, which is no small cost. For my practice alone, we're talking around $1 million. So we're not talking about insignificant sums of money here. But part of that meaningful use, for example, for primary care doctors, was to ask their patients, is there a gun in the home? Do you wear your seatbelt? Things like that.
Lifestyle.
Exactly.
Yeah.
Exactly. And the government mandated to physicians, well, you have to hit a certain number of these points in order to achieve meaningful use. And if the doctor didn't ask those questions, they didn't necessarily achieve meaningful use. And as a consequence, they didn't get any reimbursement for the government for their expenditures to implement the computerization.
Well, I don't think we'll solve all the healthcare's problems tonight, but I appreciate the insight. And
it's very enlightening because it's a topic
Yeah.
that we've talked about many times.
It is indeed. Well, after you win the primary, we'll have you back.
I look forward to it.
We'd love to have you. We've been talking with Dr. Nick Stella, and vote for him in the primary, which is your congressional district is? 11th Congressional District. And I think it'd be a good bet. I do.
Thank you very
For
much.
Segment 6, I'm David Lombardo. We'll see you next week.